How do imaging tests track fatty liver reversal? Imagine watching your liver change as you adopt healthier habits or undergo treatment. Imaging tests are the tools that help doctors see these changes without surgery or biopsy. They mainly focus on measuring how much fat is in the liver over time and checking for signs of inflammation or scarring. This way, clinicians can see if your efforts to reverse fatty liver are working or if the disease is progressing. The most precise method today is magnetic resonance imaging, especially using a technique called proton density fat fraction. This method can accurately measure the percentage of fat in your liver. It works by capturing detailed images that show how much fat is present, making it ideal for tracking small changes over months or even years. Magnetic resonance spectroscopy is another advanced technique that provides chemical information about liver fat, and it is highly reproducible. Both methods are non-invasive and cover the entire liver, unlike a biopsy which only samples a small part. This makes MRI and MISs very reliable for monitoring fat reduction during lifestyle changes or treatments. Ultrasound is often the first test used because it is safe, accessible, and affordable. It detects fatty liver by noticing changes in how the liver appears on the scan, especially increased echogenicity or brightness. However, traditional ultrasound is less sensitive for mild fat accumulation and cannot give exact measurements. Newer ultrasound techniques are being developed to quantify liver fat more objectively, which could improve how we track progress. Ultrasound elastography, like fibroscan, measures liver stiffness to assess fibrosis or scarring, which is important because fibrosis can worsen even if fat decreases. Computed tomography scans can also detect moderate to severe fat buildup but are less accurate for mild cases. They also expose you to radiation, so they are not ideal for regular monitoring. Advanced court methods are being studied but are not yet standard for tracking fatty liver reversal. Elastography techniques, including magnetic resonance elastography, measure how stiff the liver tissue is. Since fibrosis makes the liver stiffer, these tests help monitor whether scarring is getting better or worse. Combining fat measurements from MRI or ultrasound with fibrosis assessment gives a complete picture of liver health during treatment. In clinical practice, MRI proton density fat fraction is considered the best non-invasive way to quantify liver fat and see how much it has decreased. This helps doctors evaluate how well lifestyle changes like weight loss and exercise, or medical therapies, are working. Ultrasound is useful for initial screening and checking for fibrosis, while elastography adds information about scarring. Together, these imaging tools allow for safe, accurate, and repeatable monitoring, guiding treatment decisions and helping prevent the progression to more serious liver problems like cirrhosis or liver cancer. Remember, always consult with a healthcare professional for personalized advice and proper management of fatty liver disease.